Hi, I'm Dr. Asif Siddiqui from New Delhi. I'm talking about now about regarding hypertension. According to WHO, 63% total death in India due to non-communicable diseases, in which 27% are attributed to CVD, cardiovascular disease. In this, around 50%, that is 40 to 65 years of age, high blood pressure is an important risk factor in CVD. Moreover, people poorly controlled due to low awareness of hypertension. And especially in Southeast Asia, mostly people they avoid to take allopathic medicine. They go for homeopathic medicine, sometimes yoga, sometimes control of salt intake, etc., etc. In India, the prevalence gone up to 30 years. That is 38% male and 30% female, and moreover 50% male and 40% female with hypertension is unaware of the condition. Around 60% male and 50% female did not get treatment properly. International Society of Hypertension 2020 released hypertension practices guideline, but still in Southeast Asia people are not following that. Acute respiratory distress syndrome, that is ARDS, in potentially a fatal condition involving lungs dangers, and experts often associate it with COVID-19. A recent study journal, that is Journal of ACC, reports that metoprolol can reduce lungs inflammation and improve respiratory function in people COVID-19 induced ARDS. Lowering systolic blood pressure target down to the 110 to less than 130. That means substantially reduce cardiovascular death adverse event in the STEP trial. With regard to the prognostic value of ambulatory blood pressure monitoring and night-time blood pressure, the 2018 European Guideline on the Management of the Arterial Blood Pressure, that is hypertension, recommend that the diagnosis of hypertension should not only be depend on office blood pressure measurement but also on out of office measurement such as ABPM or home blood pressure monitoring 24 hours and night-time blood pressure measurement were associated with greater risk of mortality and the composite of CV outcome. Thus may be considered as the most relevant measurement for the estimating CV risk. Most patients with hypertension requires lifelong medical therapy to achieve optimal blood pressure control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted in improved adherence of therapy and BP control. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodimethylamine, that is NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has classified by WHO International Agency for Research on Cancer to be carcinogenic in human. If 100,000 patients would have received NDMA, contaminated valsartan from Zhejiang Huahai manufacturing site where the highest level of contaminants were found. Every day for the 6 years in highest dose, it could result in 22 additional liver cancer over the lifetime of these patients. The HIA study represents the largest study that tested nighttime antihypertensive treatment in which trial coronotherapy associated with significant reduction in endpoint, that is including death. Coronotherapy trial tested whether nighttime therapy is in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study included a total of 19,084 hypertensive patients During an average follow-up of 6.3 years, 1,752 participants experienced the primary CV outcome. An ambulatory blood pressure measurement was performed for the 48 hours to collect data on how blood pressure differed during the sleep. The respiratory rate reduction for CV risk or CV event was significantly improved for nighttime treatment when compared with awakening treatment. Thank you very much.